If you haven't heard, Medical Device Academy now offers US agent services. So if you're a company outside the US and you need a US agent, that's a service we offer. So you could just have somebody that's all they do for you. A US agent, the only requirements are they're in the US, they reside in the US, and they have actually confirmed that they will be your US agent on the FDA's fur website. And what that means is when the FDA has something stuck in customs, they're going to email the US agent and your company. When somebody at the FDA needs to do an inspection of your company, they're going to email the US agent and you. But the US agent could be so much more as a resource for your company because the US agent really should know the US regulations really well. It should be something they're an expert in. They should have resources. They should be able to know exactly where to find the information that you need to answer your regulatory questions or your quality system questions. And if they can't, find somebody else. But it, for my company and myself, it's not about, this is a great source of revenue. We wouldn't be pricing our services at $600 if this was our major source of revenue. The purpose of this is to help companies that are outside the US that might not be getting great advice or may have misconceptions because people have told them things rather than they know things because they looked them up and researched them. We're trying to help those companies get their products on the US market without making mistakes and give them the correct advice, give them the right information, show them where that information can be looked up. So I like helping people. I'm a teacher. I love to teach. That's why it's called Medical Device Academy, not Medical Device Consulting. I like to do this. So I had a person this morning that called up, scheduled a call with me for 6:30 in the morning. For them, it was 3:30 in the morning because they're here on the West Coast. And I was like, "Are you sure that this is what you want to do?" I sent them an email last night. "Are you sure you didn't make a mistake?" Like, no, no, no. I normally get up at 4 something in the morning anyway to go to work. She lives out in LA. She's like, I don't want to make I want to have this call at 3:30. So she got up extra early just to have a call with me to discuss the 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 philosophy and strategy behind design changes and how to manage them. And I could have spent all day talking with her about that topic because it was interesting to me. And I know a lot about it. And I know from doing 1,000 different audits, this is how this company does it. This is how this company does it. This is how I wrote our procedure to do it. This is what makes sense for you. And she asked, she's like, "So should we buy your procedure on design change control?" I was like, "No, I don't think it will help you. You already, our procedure is a generic procedure that somebody that doesn't know how to do design changes and design controls, that's who it's for." She was a quality system expert that had decades of experience at multiple companies. She had a very specific need in her industry. It's within the medical device industry. She had a niche, and she needed a procedure that was appropriate for their company that would have been totally inappropriate for the generic majority of medical device companies out there. So I was like, "No, you should revise your own procedure to do this, 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 and this." And she took a lot of notes, and I think she got a lot of value out of that meeting at 3:30 in the morning for her. Um, I get up early in the morning. I do these calls with European clients, with companies in Asia, companies in Africa, companies in Latin America, companies out in California. Usually I accommodate calls late in the evening with California, but this was a client that got up early in the morning. So it worked out and we had a great conversation. But you want a resource that is going to help you answer your regulatory questions, show you where you can find the right information, not their theories and opinions only. Just you want to know, where do I find this? Where does it in the regulations does it say this? What will happen if we do this? A lot of people are like, "Well, if I do this, will I get inspected?" Most of the time, the answer is no, you won't get inspected. You might even be extremely unlikely to ever get inspected, depending on what your company does. But you need to know that from somebody that knows the system. So Find yourself a US agent that can answer those kind of questions, that you can have a conversation with, that will hit record and send you the recording. I had a call with somebody in the Czech Republic today doing exactly that. And I've got 2 more minutes before I got to get it on a call with somebody from South Korea for the same thing. Um, we are here to help you answer your regulatory questions, and um, it's something we'd love to do. So even if you already have a US agent for your product and you're happy with them, don't hesitate to fill in that form on our FDA US Agent website. I'll put the link below, and recommend it to your colleagues in the medical device industry. Hey, you might have a US agent, but if you need help and need questions answered and need somebody that really likes this stuff and is good at it, click on the link below, fill out the form, and you'll get videos every week telling you, hey, this is how the US agent process works. And after my call with South Korea, I'm recording another video for our US agent clients. So I hope you are one of them and get to see that video. Bye bye.